How are you, Mark?
All's well.
All right, what's going on? What's bringing you in today?
Sometimes I have a lower back issue,
Turn
and
around. One finger. Where's the most?
yeah, sort of like right in here.
Longest
And then
side joint. Okay.
earlier this year, I was dealing with a neck issue where I couldn't go
Bring your head back.
Bring it all the way back, and basically I'm fine today. However, I know that I've got to do things today in order to
Okay.
be better in the future.
All right. Bend both the knees for me. Here we go. Little sit up for me. Take one deep breath in for me. Here we go. Exhale. Breathe in deep for me. Yeah, a little tight there. Breathe in deep. Thanks. Hands in your belly. Take one deep breath in for me. Look over this shoulder for me. Exhale. There we go. Good. Other side for me. There we go. All right. Face that for me. All right, I got you. Here we go. There we go. There we go. Good.
Did you get the Alice?
That was it.
Good.
See if we can go a little deeper here, but I know you spend a lot of time sitting, right? Your work is
Sadly.
sadly most of it's
I do have my computer screen up on the wall, so I'm not bending down to look at it. But
How many hours a day do you have your show? Like what? Show of a couple? How many? Is it every day or?
3 times a week right now.
3 times.
I've been on vacation for the last week.
I gotcha. Okay. There we go. There we go. Yeah, right there. Some knots in the shoulder. We'll get those in a minute. Whew. These are like the roots down here, your neck, and so when we're sitting all the time, they're being pulled on. The only way to really get that to ever go away isn't by, trigger point therapy, in my opinion. It's to get the head back. If you get the head back and fix the posture, your head's forward, and the more forward your head goes from sitting too much, that constantly pulls on those attachments. There we go. And at the end of the day, you have to use that neck Denneroll, right? And try to use that up here to help counter stretch and get that curve back in your neck. Did you have the neck Denneroll up north or just?
Yes.
Okay, good.
Have it down here too.
2 down here. Oh, excellent. You first met my father, what, like 15, 16, 17 years ago? How long ago? Good.
Yeah, I'd say 17 is pretty good guess.
17 years ago. So I know you've had on and off because I know you travel a lot. And
I've been coming for a long time, but my regularity can be a little messed up, and I certainly don't follow all the advice I should.
There we go. All right. There we go. A little traction to unlock the upper neck a little bit, just a little.
But it makes sense to me that spinal health is the most important health because the nerves travel down the spine.
Who taught you? Right, that's right. Your central nervous system, all intelligence from your brain to your body through 2 sets of nerves, your spinal cord and your cranial nerves. And if there's inflammation along the spinal column, there's misinformation or interference in that signal.
You haven't been addressing my cranium, though.
That's your wife's job. Oh, I'm just going to check, see if I can get any more. I got you. Let it go right there, that top guy. Yeah, that one right there. There it is. Nice. Nice. That was better. To me, it's like a sliding door. You get it to close a little bit, and then to get it to fully close, take that, gets the muscles out of the way, and then we can get a deeper adjustment.
Is there more than one pop in a Atlas?
Well, it's the same, right? It is the same joint moving, but to me it's like a sliding door, like a handshake. There's like partial movement and then full. So there's click, click. There's 2 levels of the adjustment.
I noticed between different animals. I'm a farmer, and I've had to see the insides of animals, and I've noticed that younger animals have nice cartilage, and older animals tend to have this sort of gristly stuff.
Right. It desiccates, it dries up. Yeah. Interesting. Yeah. I remember in cadaver lab in school, we had, I don't know, half dozen knees that I looked at, and the lateral meniscus looked brand new. In an 80-year-old plus knee, the lateral looked, healthy, not dried out, and then the medial was like gone.
What part is the lateral and the medial?
So the medial is the inside. So everybody had the inside of the knee, the cartilage was all, compressed and worn out, and the lateral looked brand new. And I get told by, it's age or weight that causes knee problems, and I go, well, how come the lateral doesn't age at all? Seems like an alignment issue. Seems like we're putting more pressure on the medial meniscus, and that's what's aging the inside of the knee faster.
Yeah, you never see an old person who's bent the other direction.
Right.
So they're always bent forward.
Right.
Well, not every old person is bent forward.
It's
the
common.
people that are bent are bent forward.
Right. The holes that the nerves go through, the intervertebral foramen gets larger when you bend forward, and so it's sort of like, well, it feels good to do that, so it must be good for me. And I go, well, is that how nutrition works? Foods that taste good are good for me, and foods that taste bad are bad for me? It's not how it works.
That is not how it works.
Right. No, he's doing good. He's doing good.
And what are we doing now, and what's the purpose?
The goal is to get blood flow in here. So in order to, again, going back to cleaning your spine, you're not going to want to bend back on the Denneroll or stretch when all this tissue is inflamed, and so we're trying to clean the soft tissue out, get some blood in here to bring nutrients in, take the waste out. We call that replacement, or what we term it healing. The body's going to heal by bringing nutrients in, take the waste out, but I call it replacement. We're just speeding up the replacement cycle of the tissue by working on it. It expedites the replacement rate, or the healing. You increase the healing rate.
We know that blood travels through the blood vessels, and obviously that's taking waste to the kidneys and that kind of thing. But there's all kinds of other systems and all kinds of other, fluids and juices, whatever. How do those things move around?
I mean, you're some areas aren't getting, going back to what you were saying, some areas of your body aren't getting any blood flow. So if the areas are so tight mechanically, they're actually not getting good perfusion. So posturally, right, if your middle back is all rigid, this area is not getting good circulation because it's so stiff. What ends up happening is if blood doesn't move very well, the plasma, or the clear fluid in the blood, leaks out into the interstitial fluid. This is what we call lymphatic edema, right? So somebody sits for a long period of time, say you've been working all day, right, and you have your legs crossed or something like that, and you've been sitting, you might see your legs are swollen, right?
Yes.
Because there's a lymphatic edema. Basically, the blood is having a harder time getting it out of your legs. So now this clear fluid leaks out of the arteries and veins, and then your lymphatics are supposed to take it. Your lymphatics then redump it back in the blood, and that's, how your body's supposed to be cleaned. Right there. There we go. We forget how much, like when you're standing or sitting, how much pressure is on this SI joint. Does that make sense? That joint's being mashed like a sponge, and it's not getting good circulation because of the amount of pressure that's on the joint. And sitting, when we're standing, the weight goes down to our heel, but when we sit, it all ends right on that joint you pointed to. And so it's like that's where all the burden's heading.
So I had at one point a spinal problem that surgery was recommended, and I came here initially to you and your father for a great deal of help regarding that. What would you say to people who are dealing with back injuries right now, and they've been offered the opportunity for some kind of surgery?
Right, I think the only people that really, and this is what I've seen in my practice, the only people that I've had to recommend surgery to, and I've had to do maybe 2 or 3 in the last 13 years, are people with previous
Out of
surgeries.
thousands.
Out of thousands, but people with previous surgeries. If you've had a previous surgery, it is difficult to stop a further surgery. Doesn't mean it can't be slowed, doesn't mean we can't manage it, but it is just more difficult. I believe that if you have everything that was there when you were born, nothing's been removed, nothing's been cut out, nothing's been tampered with, I believe we can, reposition things, take pressure off of things. I've had people with severe just disc injuries, but the worst looking discs that I've ever seen are the ones post-surgery. They do a discectomy or a rhizotomy, they go in there and they clean something out, and now there's literally nothing left. It's like having a herniated disc, and then they wipe off the jelly that comes out, and then you keep on compressing the disc, and then what little jelly's left in there gets herniated, right? And there's nothing left. There's now no cartilage at all, and it can be very difficult to manage that one. But no, there's tons of hope, plenty of hope. It's just a matter of, my question usually is, can the patient handle what needs to be done?
Well, there's certainly going to be some pain, but don't think that you're going to get your back cut on.
Right.
Somebody's going to go in there with sharp knives and cut away at your spine, and then it's not going to hurt. It's going to hurt.
Yeah, no, I had a new patient yesterday. She been having sciatica, and she's been to a dozen chiropractors. They're manipulating her lower back, and I'm going, no, you got to leave that alone. Stop adjusting the lower back. Work on the middle back. They're putting heat on her lower back because the muscles are tight, but the muscles are tight because they're trying to guard, does that make sense, the injured joint. Yep. And I'm going, that muscle spasm will only go away when the joint and nerve pressure goes away. So actually put ice on it. So almost, they're telling her to bend forward, grab her knees, and pull her knees to her chest. I'm telling her to stop bending forward or back right now. I want to first get her loosened up, but eventually we're going to start arching her back. Once we get, 5-6 visits down the road, she'll be ready to start arching back and encouraging this area to continued participation.
I found similarly that not all chiropractors are the same.
Right. It's like art. Everybody's got a different opinion on what needs to be done, and there's a lot of beauty in that because we have freedom, but there's also a curse because then people don't know what to do. It's like, gosh, Ed, what you do doesn't seem to be what anybody else does, and what do I do when I go up north and I'm trying to find somebody and nobody does this kind of work? And one guy wants to realign your hips because your lower back's hurt, and I'm going, well, it's misaligned because it's hurting. They're saying it's misaligned and that's why it's hurting. The exact opposite. I believe something gets pinched, the hips go uneven as a result. They're saying the hips are uneven and that's what's causing the pain. I'm like, no, the compensation happened first. And I don't know, it goes probably back to what I was taught by my father. My dad was injured by chiropractors that kept on adjusting him in his lower back. So, and that's probably the saddest thing. It's like, what isn't chiropractic supposed to help people? Well, my dad was injured by student chiropractors when he was in school that kept on adjusting him where he was hurting. And so when I was a kid, I remember traveling around different chiropractors' offices, and my dad would beg them to adjust him a certain way, and they'd have a different opinion. And I remember leaving one office when I was a kid, my dad looking at me and going, Ed, I'm going to teach you how to do this, just in frustration. And then I didn't have enough strength to work on my father until I was probably 13 or 14, and my dad, severe sciatica, and he got all his relief by not adjusting this area, by leaving it alone. It's like a cavity in a tooth.
So when I've gone to other chiropractors, a lot of times they'll have me lay there and then they'll pull on my legs to kind of, I don't know, I guess measure them, see whether one's longer than the other. Mm-hmm. You haven't done that.
Mm-hmm. Right. My dad did that for the first 10 years of his practice, and I don't know, chiropractors wanted something objective to look at. If I look at your legs right now, your right leg's a little short, and it goes to about even or a little bit long when I bend them. It's called a Deerfield leg check. And, if your right leg is short, it's very likely that this right hip is high, which it is. This right hip up here is about half inch higher than his left. So the hip rises up. Generally, your right hip rises up to relieve pressure. If you pinch a nerve on your left lower back, your right hip will rise up to relieve pressure on this. And now my right leg looks short. Does that make sense? It's a compensation for something being injured in the back, and your body tries to avoid and take pressure off that area. You're saying your body intelligently and purposefully changed your hip height level. Now there are other circumstances where somebody can have a congenitally, maybe one leg, maybe you broke a growth plate in your leg when you were a child, and maybe the leg didn't anatomically grow as long as the other leg, and so there's other reasons for leg length discrepancies. But leg length discrepancy aside, you're checking for hip height. You understand? And to me, the hip height will go down when you get rid of the pressure down here. Does that make sense? By diverting it to the areas around. You have to get rid of the reason for why your body, does that make sense, raised your hips. The hip height happened as a result of something hurting.
Yeah, I think there's a lot of value to being able to look at your, your iPad or your tablet or your phone by sort of, that kid in front of the TV pose like this.
Right, arching up, yeah.
Because if you can do this, then you're counteracting a lot of the things that go on during the day.
Right, you're undoing the hyperkyphotic curve that is happening in your upper back. You got it. The word doctor means teacher. You're supposed to learn something. I hope every visit when somebody comes here that they can take, something home with them and go, okay, I learned something about curves in the spine today, or that, my alignment was supposed to be such today. At the beginning of your visit, when I did that hug adjustment, right, remember the anterior adjustment, this area pretty much didn't want to budge.
Okay.
And that to me is a red flag. If this moved a little bit, this didn't move at all, and I think this didn't move at all either, that means 12 vertebrae in here, you only are really moving in 3 or 4 of them, right? And so any work that was supposed to be done up here has to be then done either in your lower neck or in your lower back. You're looking for your chiropractor to not only tell you that the curves in your spine are important and that posture is important, but to have a plan to fixing it, right? It's one thing to say that your teeth are crooked, and that they're dirty, but okay, we're going to clean them and we're going to send you to an orthodontist to get the teeth straightened. It was stretching that made your posture worse in the first place, and it's stretching that fixes it. It was injuries. Injuries cause stiffness and then avoidance and guarding, which then essentially, because of the avoidance, that was essentially a stretch. You avoided one side, so you stretched your body to the opposite side, but it was stretching that changed you for the worse, and it's only stretching that fixes it.
And if I'm standing up straighter, then my spine's in the position it's supposed to be.
Right.
Presumably that's good for the nerves.
Well, say that if it's locked up, then there's a lot of acidity that builds up along the spines, and that can pose an interference to the nerves. The mobility of your chest is what keeps the lymphatics flowing, the toxins from building up. All right, now press your elbow back. So right here, you're gonna push that back into there you go. Okay, so put your hand on your hip, there you go. 1 second. All right, press back a little bit. Press back in there. Okay. All right, good. Tilt to your left a little bit, tilt your head left a little bit. Just lean away from me a little bit. There we go, good.
Never experienced anything I've done in my life.
Tilt your head left a little bit for me. Tilt your head left a little bit.
I heard the crack.
Did you hear it? I heard it too. Heard it real good.
Happened to be really close to my ear. Yeah. All right, so tilt your head to the right a little bit. And then tilt your head to the right a little bit. Good, yeah. Good. On your hold on to the table as best you can for me. Just gonna grab onto. There we go. I got your leg. Back your leg. Wow. Nice. There you go. Nope. Relax. I think it's broken now, Ed. I think it's broken. Good. Not the pinky. Okay. Hold on yourself as best you can. Nice. There you go. Good. Nice. Let it go. check this middle back again. I know we got it all nice and loosened up now. Breathe in deep for me and see if we can get a little better here. Come on, actually, let it go. There we go, a little extra, I know. And just every day, the rest of your life, you have to, Mark, just participate in combating this area. And when it's been a long period of time since your last adjustment, Ed, it's hard to do. You know, that's where finding somebody to help loosen up. So you're saying what to look for on YouTube. You want somebody to be actively trying to get all your parts of your back moving evenly, and then have a plan for stretching. There you go. Yep. You ready? Good. And then let that. Yep.